I think that there's a way, Sarah, for you to change the name on there temporarily to say just Sarah on your screen.
Thank you. All right, we have folks joining now. Thank you so much for people who are telling us hello. Let's go ahead and get started. So I'm Sarah Gustavus. I'm the Mountain West Region Manager for the Solutions Journalism Network. I'm joined with my colleague, Michelle, today. We're going to introduce ourselves and then get started here. We are not allowing people to be on mic asking questions today. Please ask your questions in the chat or make comments, and we're going to have lots of opportunities to take questions this hour. So I've been with SJN for about 2 years. I work with newsrooms of many different sizes in the Mountain West in the United States. And Michelle, do you want to introduce yourself?
Yeah, so I am the West Coast Region Manager. That means that I work with newsrooms all across the West Coast, all of the folks touching the Pacific Ocean, as well as Nevada and Arizona. Soy bilingüe, hablo español, so if you are coming here from Pamplona or from Argentina and you have questions in Spanish after, you're welcome to email me and we'll provide our emails afterwards. And just happy to be here.
Yeah, and I know that a lot of folks are really stressed out. These are really hard times, and so I appreciate you all coming, engaging in this conversation about how we can do really important solutions coverage that will better inform people around the US and around the world about what's working to deal with the COVID-19 outbreak. So this hour in the webinar, we're going to first define what is solutions journalism. We're actually doing 2 webinars this week. Tomorrow is in a more advanced workshop. Today, we're going to get into the 4 pillars of what makes a good solution story. We're going to look at those examples. We're going to talk about specific examples around coverage of COVID-19. And we're also going to talk about strategies for how you would apply these principles to your coverage right now. And also looking ahead as to we have months ahead of stories that we're going to need to be telling to inform our local audiences, our national audiences. And so we're going to be talking about how you can start to think strategically now about covering this story as it evolves. All right, so we'd love in the chat right now for folks to share with us what you're hoping to get out of today. That's what we have planned right now, but are there any specifics of what you're looking for? Also, just to remind folks who are joining right now, we are asking to please post your questions to everyone in the chat. There might be some opportunities for folks to answer them in the chat, and we're going to try to answer as many as we can. Deal with the coronavirus effectively, very important. That's the big picture thing that we're trying to get at today. There's a question about recording. Yes, we are recording this. We are going to share it widely. It will be available to people as soon as possible after the live webinar today. Are folks having trouble seeing the, can you see the slides behind right now? Okay, that's great.
Okay. I also want to let people know that I'll be sending out some resources that are not, we're going to be talking about solutions journalism because that is our main focus here for Solutions Journalism Network. But I've been a longtime health reporter and I found a few, just some highlighted pieces of some resources online that are useful for the science reporting if you've never had to do any kind of health or science reporting in the past or just needs a little bit more focus. I've got some stuff there that I will send out in our email and I'll put it in the chat a little bit later.
Also, we have a comment here about looking for ideas of what to offer readers in a small town that I cover. So we have lots of different people joining the call today inside the US, outside of the US, in different countries. We know folks are working for lots of different outlets, working in video and print and digital and covering different communities. And so we're speaking very generally in this webinar. All of this can apply to any kind of journalism work that you're doing covering COVID-19. Can we keep reporting about coronavirus without exhausting people? getting weary of stories myself. Yeah, people are like, we feel the same thing that our readers or listeners or viewers are feeling. And that's our argument at the Solutions Journalism Network, is that not only are people getting weary, but people need this information. They need to know what's working. They need to, and not just hero worship and kind of, oh, this is a nice story that makes people feel good, but real things that people can take action on. They can talk with their community about, they could talk with elected leaders about. That's what we're going to be discussing today. Tips on how students can find and contact community sources. We are going to talk a little bit about sourcing today. Looking for story ideas, underreported coverage when it comes to COVID. What stories need to be told that aren't? That's exactly solutions journalism and what we're covering in this webinar. How solutions-based approaches can be applied in this context. Yep, we're going to do that at the university level. Ideas for less experienced journalists. That is, our focus today is maybe less experienced journalists, but maybe people who aren't as familiar with solutions journalism. We're going to be kind of trying to get at the intersection of that. Solutions journalism is about giving a solution that's already working, but the coronavirus is a new problem. How can it be dealt with in a solution-based point of view? I think that's a really good place for us to start, because it's exactly what we're talking about today. I know I've already been hearing from some of the newsrooms that I work with that, yeah, we love doing solutions coverage, but it's impossible to do right now. It's actually not impossible. There are some strategies. There are some limitations in implementing our strategy as things are continuing to evolve, but we can definitely give you some ideas today to get started with that solutions coverage. All right, Michelle, you want to take us forward on what are we talking about when we say solutions journalism?
Well, let's just start with our definition. Solutions Journalism Network, we have a very strict definition of what we believe is solutions journalism, and that is rigorous evidence-based reporting on responses to social problems. So let's go ahead and just jump into it. We define that, we break it down into 4 pillars of what every solution story should have. What we are talking about is moving from only talking about the problem, which is important reporting that is needing to be done, but it is being done ad nauseum, as has already been mentioned in the chat. What we're talking is moving towards what some of the solutions exist, and we have those examples there of looking at some things that people are doing to try to make things better. So we are talking about a response to a problem and really how it happened, how somebody made something better or worked on attempting to make something better. We want to have as much evidence as possible. We do know that that is challenging right now because COVID is a novel coronavirus. It is new by definition, but there are some things that are not new that have more evidence, and there are some things that are new but have a little bit of evidence, and we'll talk about how to do that in a solutions way. Also, we want to have some insights. We want to better understand the problem and better understand the solution. What are the lessons that can be learned here? Not just inspiration for, what people are doing. And we want to have always the limitations, because we want to avoid puff pieces and make sure that we are doing solid journalism. Do you have anything that you'd like to add, or can we switch to the next? Okay, and I really like this slide. I feel like Linda made this wonderful mnemonic, as we are talking about telling the whole story of what responses are done, and what is the response and how it addresses things, how it works, what is the how done it, offers some insight, includes limitations, and provides evidence. So that gives you that mnemonic of remembering we want the whole story.
Yeah.
Next slide.
Can I make a comment about evidence, Michelle?
Yes.
I think this is something that, we talk about all the time in every other story. And when I'm doing workshops, one of the things that I spend a lot of time talking about is evidence. What qualifies as good evidence? And this is challenging, is, even when we're not in a crisis. What we're looking for is data. We want quantitative and qualitative evidence. Not someone says it's working, but how many people are affected? How many people are part of the program? How many people have they reached? Or, you can ask your sources, how are you measuring success here? And look for lots of opportunities to then verify that and really get into, the best evidence that you can provide for your audience. So it goes beyond being a nice story about nice people doing nice things in the community. And there's some real teeth to it that other folks can learn from it. They can maybe implement in their own community, and they can share those responses widely. That's one of our goals.
So I want to talk about this story about the coronavirus testing and how it went mobile in Seattle. This is one example of a good story that has all of those 4 pillars, and we'll go over that really quickly.
Internet's a little slow. Lots of folks working from home right now.
So this story talks about how they did the drive up things in Seattle, and this is modeled off of things that have been done in other parts of the world. And so there is a little bit more evidence that this is how this is working. We can break this down. This will also be in your email that we'll send you afterwards, so you can read the story directly, and you'll also have a link to this annotation that will show you exactly like the different pieces of this puzzle. So first we have a very clear evidence. Can you open up click the show more, please, Sarah?
Show more?
Underneath. Where Linda has her comments, can you just click on that,
yeah,
show more?
Absolutely.
Yeah, thank you. So really, we've got a clear understanding of what the problem is. They're trying to contain coronavirus. So they have these mobile clinics, and they want to attempt to identify cases in Seattle, because the more cases that you do, you get a better understanding here of what the problem is. You've got a better understanding that there's some delays in testing, and basically that we are taking this slice of the problem, not trying to fix coronavirus with one single story, but look at one thing that is being done and how well that is working. So it's very difficult to screen people in a hospital. This is some of you have already been seeing this in your own communities. So we have a little bit more details about the problem. We've got a little bit more insight of understanding, what is the scope of the problem, some of the delays that are happening. And so they started this drive-through clinic. People have to do this online survey. If they have the different symptoms, then they can be qualified to do the drive up. But they do not allow for people who are asymptomatic to be screened. So we're already seeing here, like we have some of the how done it of what they did, exactly how they did it, and then we have a caveat right away, like this works for this particular population, but not for other portions of the population. Again, those caveats are very important for us to understand what's going on. Within the 2-hour test block on Tuesday, they were able to collect samples from 40 to 50 patients. So that's already, we've got some evidence right there of how well this is working for at least a certain portion of the population. Not a ton of evidence, but it's giving us some sort of an insight of what is going on. We also have some more context coming up here. There's some strong context here. We talk about how it has been done in other places, so it's giving us better understanding about the issue. We have Dr. Jerome as a good character. We are not talking about Dr. Jerome the hero and how he fixed everything, but the work that Dr. Jerome did. Can you scroll? And then again, we want to have as much of that how done it so people can read this and get some really good understanding about how things are happening, how they're doing things in the clinic and not, or how they're doing things to the lab and not just in the mobile clinic. Also, we've got a little bit more idea that we're able to screen 476 patients. And so again, a little bit more evidence, not a ton, but we've got some initial understanding of what's going on. We also understand another limitation. This is not everywhere. This is just in one place. And they're already having a problem with supplies running low. So we are seeing an approach. It is hopeful for folks as they're reading it. They're getting some ideas, and it also gives you the opportunity for other people to be able to replicate this response and learn from the things that are working and the things that are not.
So a really great way to start with a solution story for like, I want to do this is to just write down those 4 pillars as you're planning the story. What is the problem? And then right now, the huge problem is how do we stop the spread of COVID-19? That's a really, it's not just one story. There are many, many stories there. So what slice of that can you take and look at? In this example, it was testing, so you've got the problem, the response to the problem, the evidence that Michelle, noted on, and Linda Shaw is our colleague at SJN, and she annotated this. And then the evidence, the limitations, and then the insights, the things that other people can learn from. If you hit all 4 of those pillars, it's a solid solution story and informs your audience. It starts to meet the threshold for our solution story tracker, which we're going to be sharing in a few minutes. Do folks have some reactions to this or questions about this particular annotation? We didn't produce this story. SJN doesn't produce content for newsrooms. We work with newsrooms to support their reporting on solutions to important social issues in their community. Right now, COVID-19 is an important issue, across the world. So we're all rallying around this particular problem and many, many different responses. But we thought this story was a great example. It's from a reporter in Seattle. I agree with Samar. It is very well structured. It's a very understandable story and really provides some clear insights that folks can use no matter where you're reporting from. I'm so glad that it would help with students. We wanted to pick an example and annotate it of a really straightforward story. Sometimes we see stories where the evidence is a little bit lacking or the limitations are a little bit lacking. There could be more there. And when we have smaller groups of webinars, we like to kind of debate those with journalists and say, what might we do different here? How could we strengthen this story? Because one thing, when I started getting involved with the Solutions Journalism Network, one of the first things that happened for me is I started to reflect back on my own previous reporting and think of opportunities that I could have made my reporting even stronger using these 4 pillars, using these strategies. Just one more moment, if anyone has any questions about this story, or we can move on and talk about the imposters. But I hope that this made the 4 pillars really clear of what we're talking about. The core story is how do we stop the spread, but Sojo stories are not asking how people are coping with shutdowns or challenges. There certainly can be stories about how people are coping. Those are really tricky. We're going to talk in a minute about, we're starting to see lots of stories that are very close to solutions journalism. They're very immediate responses that we don't have a lot of evidence at already. And this is something that we see in working with journalists on other stories as well. Sometimes something is truly new. And I tell people, that's a great story. Like, you should absolutely do that story. And then your follow-up and something you can return back to is to when it's been going on a little longer and when you can gather a little more evidence, when there's data, when there's research, you can return to that story and do a follow-up with the solutions angle. Doesn't mean don't do the story right now. The small slices are so important. I absolutely agree. Jules pointed that out to Kate. Small slices are also more manageable. We can get more specific evidence. We can make the story really clear and understandable for folks. I'm going to jump back to my PowerPoint here. All right. Let's talk a little bit about imposters. And when we talk about imposters, we're not saying that these aren't good stories, these aren't stories worth doing. There are really great examples to do, reasons to do profile pieces of amazing people that are responding to the COVID-19 outbreak in your community. But when we talk about solutions journalism and the 4 pillars of solutions journalism, what we're not talking about is hero worship. And hero worship is one story about an amazing person. This is a slide that I like to use in my workshops. And the woman on the left, the Mommy Milk Factory, is a really neat little very short documentary that I saw on Facebook. It's a woman whose body naturally produces too much breast milk. The story, though, is entirely about her and this kind of situation she has, and she mentions that she's helping babies and she's helping families, but it doesn't go into why would babies need donated breast milk? Why might families need donated breast milk? How do you know that it's safe? This woman seems very nice, but how do we know that she's not passing on any illnesses to other people through her donated breast milk? The story on the right is a more in-depth story about systemic change. It's looking at breast milk banking in Brazil, how they set it up, why they set it up, why moms and babies might need donated breast milk, how they connect people, how they make sure the supply chain is safe, and also how other Latin American countries have used the lessons from this breast milk program in Brazil and replicated it in other places. That's what makes it a solution story, to go beyond that one person. And a really quick way to do that, so a couple people have asked about sourcing, is to make sure that you're not just quoting one person, one organization. Who are their partners in the community? Who else is doing similar kinds of work, so that the story is about the issue and about the response, and not one individual, not one profit, not one organization or one church and what they're doing. Also, solution stories, and this is a tricky one right now, they're not theories. You know, the COVID-19 outbreak, there's a lot of things that are evolving very, very quickly. There's a lot of theories and ideas out there, and we need, you know, maybe it's important to report on those, but to do a solution story though, you wanna look at something that's already in process. So here we have an example that I often use of a Brookings Institute, you know, a think tank piece about the idea of using media to promote adolescent well-being, to discourage young people from, you know, using drugs and alcohol and engaging in risky behavior, versus a story from Iceland about a program that they implemented where they have evidence that there was some success, and how the lessons from that response can be used and can be replicated in other countries. So we're looking for something already in process. What does that mean right now? That means there are other countries, South Korea, China, Taiwan. There are other places that have been dealing with the COVID-19 outbreak a little bit longer. So what lessons can we learn from them, from a response that's already in process, like testing in South Korea or testing in Taiwan? What can we learn from that in our country? Also, solutions journalism is not magic bullet stories. We're not looking for one solution that will rescue everything. We want to tone down the rhetoric. An example that maybe this is a little more relevant for a US audience, but the Valdez oil spill in Alaska, you know, really there were all these birds that were covered in oil that they were trying to rescue, and they found that specifically Dawn dish soap, a brand, was really effective at doing that. And they've continued to use Dawn dish soap to clean up birds and oil spills, you know, for decades now. And this has been really great for Dawn. They have commercials that promote this. But the idea that Dawn dish soap is rescuing birds is not the full story. It's not a solution story, because there's a lot going on behind that. There's a lot of details about how do we save wildlife? How do we prevent wildlife from being caught up in an oil spill? The story on the right goes more into those details of exactly what wildlife restoration looks like, the limitations of cleaning up birds with something like Dawn dish soap and then releasing them back into the wild. What do we know about what happens after that? So these are some examples of what we call imposters. Again, these are not terrible stories to do. If you have a relevant story to do for your community that's not quite a solution story, do it anyway. But if you want to take it a couple steps further and you really want to do a solution story, you can come back to the 4 pillars and you can utilize those to do some great solutions coverage. Does anyone have any questions at this point?
There were a few questions that came up.
Mm-hmm.
It says from Jody, I'm seeing anecdotal for now evidence that although this is hard right now, there may be some really good things coming out of the pandemic. With a speculative piece, for example, about how we've learned to live without going to as many places has created less traffic, less greenhouse gases, etc. Would that be solutions? I think is the point.
We are seeing those stories. I've seen a lot of stories myself, and I've been putting them into a category of save stories, you know, that are adjacent to solutions journalism, but not quite, because we don't have enough evidence yet. There is some very, you know, there's a slice of evidence right now that I know researchers are looking at. I think some of this reporting on the solutions and what this means long term is we're going to have to wait a little bit on that. I worry that some of the stories that I see coming out of like the maps of pollution feel a little bit like magic bullet stories, because I don't know that it's entirely realistic that we're not going to stay like this forever. It's going to, you know, there's going to be some change after this. And so I think it's something to maybe put on your radar to keep reporting on. A lot of these stories of things that are happening right now, even if it's not a solution story this week or next week, it could be 6 months from now. It could be a year from now. Michelle?
The question that I've been wondering is, will anyone learn from this and then institute something that would be a solution later, that would be a solution story later? So that's something that I would keep my eyes on.
Absolutely. speaking of which,
there was another question that, if you don't mind, from Jeff. Another point I like about solutions journalism is how it provides a higher level of accountability. If they can do it in city X, why has much more well-recorded city Y not done it yet? And that's a very important point.
we have seen that again and again in investigative stories that have used a solutions lens to say problems that were seen as unavoidable start to be seen as unacceptable when you look somewhere else and say they have these things in common with us, and look, they've implemented a different response and gotten different results. That's where there's this great opportunity for accountability journalism using the solutions approach. There's also a question, are there any yardsticks to know when it's okay to do a story, to know when it is beyond theory? The answer to that is evidence. How much evidence is there right now? If there's not a lot of evidence, it's not a solution story yet, which doesn't mean you don't do it. It means you keep looking for that evidence for potentially a follow-up story. Our story tracker, which has more than 8,000 stories, and we're going to talk about a specific collection we've created for COVID-19 coverage. That's the framework that we use to decide which stories go in the tracker that anyone can search for and look at as examples of great solutions journalism. There's got to be evidence. It can't go on the tracker without it, because then it's just a theory. It's nice people doing nice things, or it's an idea of what might happen. It's not a solution story yet. We have another.
So, yeah, go ahead.
Yeah, there. Francis has a comment. There's a serious shortage of masks in Kenya, and this man is making masks made from Ankara. Oh, the questions are coming really fast. The African fabric, and distributing freely to people. No one has evidence, however, of this works like the other proper masks we know. Can this fit in a solution story without proper evidence on how effective this is? I've been actually thinking of that, Francis, and wondering, we have a category of solution stories called Instructive Failures that might end up being, sometimes, there's people think there's a great solution and it doesn't work. And so it might be an example of something that there was good intentions, but it didn't work. And that's where it's like, we in solutions journalism, we want to go beyond good intentions and look at the evidence and limitations. So a story on these handmade masks, which I've been seeing more and more stories like that, would absolutely need to look at, do they work as well as other masks, and what are the limitations of them for it to be? But it could be a solution story if you cover those things. It could be really informative to people because these are starting to pop up and people are really desperate for this, for masks and protective equipment right now.
So all of these questions are great to help us transition to talk about, you're already seeing a lot of these stories right now, guys. The Netflix party, letting people talk to each other on Netflix while they're watching a movie. Also, this person who said, I want to do something, and is putting themselves out there to be the guinea pig for the vaccine. And then people doing these different workout parties and all of these other things. These are all legitimate, interesting stories, but they are not solutions yet. Why? Because we don't have evidence yet. However, these are another, because we've already heard Sarah say this, there are many stories that you might cover now, circle back to, do we have evidence that that Netflix party did anything? Did it do anything for anyone? Do we know how it worked to make people less bored, less whatever, lonely? And what was that loneliness? What were they trying to solve there? Is it depression with the workouts? Do we know if people were less depressed because they had those workouts? Where did that evidence come from? Is there anyone who is actually looking into that? Those are the types of things that are really worth looking at. And then, of course, here with the vaccine, when we have the vaccine, a story on how they process that vaccine, how they got there, that might be a solution story as well.
Another interesting angle, sometimes I've talked with lots of newsrooms about this in many different topics. Sometimes there is something new. COVID-19 is new, but developing vaccines is not new. There's potentially an opportunity there to say the news hook, the reason why we're talking about vaccine development is that there is a new experimental test in the United States, but then go look at what can we learn from the past? What can we learn from other efforts to quickly develop vaccines? What worked? What didn't work? how did they do it? What were the limitations? What are the insights that we can use today? That could still be a solution story right now, where you're talking at the top about what's going on today, what's going on with the COVID-19 outbreak right now, but what can we learn from past similar efforts? There's a real opportunity there that I know, takes a little bit of time, but is a totally possible story for newsrooms to look at.
I'm responding, if you don't mind, I'm responding to a question from Virgil about, could you create your own survey to get some data to see about specifically the Netflix party? I would think with the Netflix party, that would be a little bit hard. I do know newsrooms that have created their own scientific surveys and have gotten data where there did not exist data before. That is a big endeavor, but it is totally possible. But again, it would need to be a scientific survey and not a non-scientific survey to kind of get a better sense of, how reliable is that evidence. Maybe you do a non-scientific survey, but you have to make that very, very, very clear that you don't have full sense, and you got to get a sense of who's responding, why are they responding, is it a self-selecting group? So really need to be careful with the self-selected data.
Absolutely. Jody also asked a similar question of online music concerts and statistics about how participation in creative pursuits in the art is good for people's psyches, as in less depression. I think there's not going to be enough evidence right now, Jody, to do it specifically about responses in the current outbreak, but you could, again, go back and look at a previous similar situation and say, we've got the evidence, we can look back a little bit, do that solution story with saying, how can it inform how we're looking at success right now, and be really transparent with your audience that we don't know. We don't know if these online concerts are helping people. We can know what's happened in the past that we can measure, and you can let folks know that you're looking now at kind of what might emerge from the current situation. There's a question that is being answered about Freelancer Resources. SJN is putting together resources of folks who are pitching stories. What about business stories? That's such a good question. I like to tell folks that, the solutions approach can be used on absolutely any beat. Just stick to the 4 pillars. So on a business story, you can look at how are businesses responding to the outbreak? What do we know about the evidence of success? And also, what can we learn from past responses that are similar, as a way to get at business stories. Sally, if you want to ask a more specific angle on business, I'd be happy to talk about that a little bit more. Just to remind folks of the 4 pillars again, they are: what is the problem? What is the response to the problem? What is the evidence that it's working or not working? What are the limitations? And the limitations are in the response itself. For example, I live in the state of New Mexico in the United States. We have a very high poverty rate. Sometimes people say, well, the limitation is that we're poor. That's not enough. We want the limitation to be about the actual response to the problem itself, to be much more specific. And also insights. What insights can we learn from this that other people would need to know in order to replicate or to learn from that response? How come we're not talking about the medication to cure this in France? I don't know about a medication to cure it. I've not seen a story that, I've not seen coverage that indicates that there's definitely a medication that cures it. I don't think that we've seen that yet.
So there has been some reporting, not specifically in France that I'm aware of. I'm more familiar with some different projects that have been done in India that have successfully treated people. It would be very interesting to look at, how did they treat the person? How many people have been treated? Again, you want to go back to that evidence, because there are some people that are getting better and they've used some sort of a treatment, but have they treated enough people to really show that this wasn't placebo, that this wasn't something that just worked, or it looked like it worked, but the person was getting better already? Those are the types of questions to really ask to make sure that we are giving scientific and effective information. I think right now there are things that look like potential cures, but we're not sure yet.
There's also a question: how can a journalist use this approach in order to report on nature conservation without excluding the well-being and health of people? How to connect one to the other? I think that, that relates back to our question that we're seeing a little bit of evidence that the restrictions on people's travel and movement has resulted in a reduction of air pollution. But yeah, those good solution stories will include the limitations. The limitations are where you get at, you don't want to tell a magic bullet story of, oh, this is working for conservation, and leave out the impact on people, because that would be a limitation of a really drastic response. We want that in stories now for coverage of COVID-19. We want that in all stories about solutions journalism.
I do want to highlight another question that came through. How can journalists of color effectively and appropriately use the lens and power of their diverse perspectives and experiences of their homelands within the pillars of solutions journalism in covering this global battle? And I think that that's a really important question, because really one thing that we like to talk about is that a lot of communities, when you look at, and this is something we talk about when we're not talking specifically about COVID, but is there a community that is being hit hard by a specific problem? If you're talking about like poverty, we use the example sometimes of, I'm in Los Angeles area, South Central LA was synonymous with a lot of things that probably come to you, thought of just violence, thought of as just poverty. And there are a lot of things that is a community that is very diverse and has a lot more going on. Yes, those problems of poverty and those problems of violence did, especially in the 90s, exist, still do exist to some extent. But there are a lot of people that are working on doing things to make it better. And so not looking at a community only by its deficits and the things that it doesn't have or the things that are working poorly, but looking at communities for the things that they are doing right, and things that they are doing to improve themselves, because that, as far as I'm concerned and as far as I've noticed, always exists to some extent.
Absolutely. Absolutely. There's a comment here from Debbie saying, I was going to say great care needs to be taken to avoid rumors or folklore in identifying a problem. If identifying the problem is not fact-based, your premise is faulty. Yeah, defining what a problem is really important, and is something that I talk with newsrooms all the time, because it's also who's in the room defining what the problem is. I think, you want a diverse group of people who are looking at what's happening in the community, identify what are the most important, problems for our community right now, and what responses are working. How can we apply the 4 pillars to doing great solutions coverage of those responses to problems that are really important to the people that we're serving with our journalism. All right. We did a lot of questions.
I think we took a lot of questions already.
Let's go to some more examples. Michelle.
Yes. So here is an example of the use of telemedicine by the Philadelphia Inquirer. And basically, they looked at how expansion of telemedicine, this one really leans into the caveats, like they have it even in the headline, and I welcome that. But really, how is it done? The Trump administration lifted some restrictions on Medicare for using telemedicine. Insurers are pushing for more telemedicine. The Pennsylvania governor also relaxed some rules, but not all of the rules were relaxed. And so that's a big caveat that we saw there, that didn't necessarily work for all people. We see that by doing more telemedicine, you can save beds in hospitals, you can keep doctors healthy, because when they're exposed to viruses, they can get sick and continue to, promote that illness to other people, contract it to other people. There's some evidence here. Some of the evidence is looking at how other states have been doing some things to create telehealth parity laws. They've been doing it because they saw some effectiveness there. There was a 20-fold growth in one particular program that they were looking at when they made some changes to the laws. A lot of caveats here. Cost is a huge caveat, because not everyone can afford it, and not all insurers cover telehealth exactly the same way that they cover when you go into the doctor. People often will have to pay their copays with credit cards right away. If you are poor, you may not have a credit card. There's a lot of issues because there's a lot of rules against people being able to get any kind of abortion pills this way. And then, kind of looking both ways, there's a lot of groups that don't have access, but they're also doing some rules to make it easier for those folks. We're also seeing city public health doing it anyway, even though the rules don't actually apply, and some folks just relaxing their costs and not charging folks.
Another story that I'm starting to see a lot of, particularly in the United States, are these efforts of people to help out their neighbors. We have vulnerable elders, people with compromised immune systems, and folks saying they want to step up and they want to help people. How do they know beyond their own family, beyond their own friend group, who might need help? And it's called mutual aid. And we've seen several stories, and we have a couple in our collection specifically on COVID-19 coverage that look at what is mutual aid. And this is a story from Vox, and people using Google spreadsheets for mutual aid to help folks buy groceries, get things that they need. This story really goes into the details of how it's created, how many mutual aid groups they were able to identify in countries across the world, what it looks like, how people are utilizing it. There's some limitations of, folks who are going out, and we're starting to see some of these stories too, that, there's a great intention of helping your neighbors, but a limitation is, a challenge is, how do you ensure that what you're bringing back to them is not contaminated, is not going to make them sick inside their house? There are some steps that need to be taken to make this very effective. In this story, talks about the how done it, talks about the challenges and the limitations, and then the insights that folks could utilize in order to implement this in other places. And as we mentioned earlier, that although we are in an unprecedented time and everything seems entirely new, sometimes these stories actually have a longer connection to things in the past. So I like this section in the Vox story that looks back at mutual aid is not actually an entirely new idea, and tries to pull out some insights from past efforts using mutual aid, and also in identifying particularly vulnerable people in communities, people who were vulnerable before this crisis hit and are especially vulnerable right now. So there's a lot of detail in this story. I'm going to go ahead. We are going to put this in a link, and I want to share it in the chat here.
I want to also add that we just gave you two examples. One example is talking about government changes that are making things better, big structural changes by the federal government, state governments, and insurance companies to make telehealth more available. But then the Vox example that we have in front of you right now, that is more of a grassroots Google, Sheets, something that anyone could do. So like, just because it's not a government thing and it's a more grassroots thing doesn't mean it's not a solution story. So do know that both of those are options.
And both of those are important stories to be telling right now. And I like both of these examples because it demonstrates that we can be telling solution stories right now, using the evidence that we have, talking about the limitations, being really clear about what slice of the response we're looking at, and what insights we can learn either from the response now or from past similar efforts, hits all the 4 pillars, gives us solutions coverage that's useful to folks right now. All right. So as we've kind of touched on a little bit, solutions journalism, many people ask, isn't this just good journalism? Absolutely, it's just good journalism. It makes it stronger and more complete. As someone mentioned earlier, it strengthens accountability. It takes us from problems that are seen as unavoidable, start to be seen as unacceptable. When we see examples that have worked, and you need to localize that. For example, I have some newsrooms in my region in the Mountain West in the United States that they've looked to other states, other parts of the US, even other countries, to say, how have they responded to a problem that we have in a different way? What can we learn from that? And they offer that local context. It's not just a story about Alaska or Japan or a country in Europe. It's a story that they bring it back and say, this is what we can learn from this now. This is what's different about our community, and this is what we have in common with another community that's responded in a different way. We're also investigating problems right in front of us. And this is something that, although COVID-19 is in front of us right now, it's so obvious. I want to make it really clear that, this can be applied to any story, any beat. This can be something that you use for your entire journalism career. The problems that are, as we like to say sometimes, keeping people up at night are the most important problems for our communities, are great opportunities to look at solutions coverage that will inform people about what is possible, the evidence, what they can learn from it. Michelle, do you have anything to add there?
I think that you've put most of it there. I do want to say, kind of reflecting back on a comment about the mutual aid story, that's been around for a very long time. When you have something that's been around for a very long time being used in a different way, you can say, okay, how is X approach, you got more evidence. There's more likelihood that you'll be able to do a story there, because it's something that's not new. It's an old approach being used in a new way.
Yeah. There's also a question about the examples that we're using are longer print stories than they are. Do you have ideas about how or if this approach can be applied to daily broadcast radio? Yes, and you are so lucky because Michelle and I both come from daily broadcast radio. Michelle, do you have some ideas of how folks could do that in those quick turnaround radio stories?
You know, if you're doing a 1-minute radio story, you can have all of those 4 pillars. They're probably only going to be a sentence each. Usually I'll say if you've got then toss to web and then put more evidence in there, that would be great. But you can have this in a short story, just making sure that all of those 4 pillars are touched there. And then it also leads to, maybe there are follow-up stories that you'll spend more time to do the longer 4-minute piece, if you've got that opportunity.
Absolutely. So I come from working in radio and television before I joined SJN. Those 4 pillars can go in TV stories as well. It does mean you need to pick, when we talk about evidence, sometimes people say, well, what is the best evidence? And the answer is not, sometimes you need to discuss that a little bit with your team, with your editors, with your whole staff. You pick the evidence that is the strongest, the evidence that you think is the most understandable for your audience. If you just have to pick one piece of evidence, have that discussion about what's really meaningful for this story, and then stick to that in those short broadcast stories. But you can absolutely do it by focusing on the 4 pillars.
Yeah, and that's the same thing with video. We've also got some other, can we move to the next slide?
Yeah.
We've got a lot of things that are here to help you, including our solution story tracker. If you go to the solution story tracker right now, we have a COVID collection that is all different solution stories. There are, as far as I understand right now, if there isn't, there will be. Our story tracker has radio examples, it has television examples, it has print examples, web examples, all of the above. As long as it has those 4 pillars, and it's been submitted. So if you've got something great, I know a few people said, oh, I did a story about that, I did a story about that, please add it to the tracker. We're trying to get things put in there as soon as possible. And we have some other ways to help you out for broadcast as well. And I'll talk about that a little bit later.
So let's go to how do we do this? And we can talk a little bit more if there are more questions about particularly broadcast versus text versus online. Here's some key questions that Michelle's going to go over for us, and I'll open our blog specific to COVID-19 in a moment. Michelle.
I'm sorry. Oh, I'm sorry.
Key
I was
questions.
reading the question in the thing, and I'm sorry. So we've got these questions, and we've actually got a blog that is specific, has specific questions that will give you some story ideas. But really, generally, any solution story that you're working about, the question is, who is doing this better? If you're working on a problem, right now we're talking about COVID, but I've done a lot of other problem stories. Who is doing this better? If someone is trying something new in your community and you're not sure, where that came from, where did you get this idea? And often they will say, you know what, we really liked the way Miami did the same thing, or somewhere else, anywhere in the world, we want to be like Norway. I don't know. Get an idea what that is. What study was done? What research was done? Or maybe you can just kind of look a little bit more at that example, especially when you're working on a story over and over again. That who is doing it better will give you so many more story ideas and new ways to frame your stories. This blog post has a ton of different questions. Who's working to help the elderly? What's working to help quarantine people vote at home? Look at that and remember, you want to lean on that how it worked. Because I know that a lot of people are saying, well, now we're going to do all vote by mail. Oregon has been doing that for a very long time. They did it well before there was a quarantine. How well did it work for them? Or do they have new things that they're concerned about? Make those comparisons to your own community and whether or not that's going to be able to work out.
Someone asked earlier in the webinar about sourcing and how do you find leads. This is a great opportunity to find leads for your stories, whether you're a newsroom-based reporter or you're a freelancer. We're going to be sharing the link to this in our follow-up email, but any of these questions could lead you to some really interesting sources and leads for stories that other people aren't doing, for stories that need to be told in communities. So one of the big questions that we get a lot is how is this not advocacy? And I know that this question of what counts as advocacy is not the same conversation in the US as it is in other countries around the world. I'm going to speak a little bit to kind of the US specific question and how we answer it for advocacy. We do want to avoid, by sticking to the 4 pillars, by avoiding hero worship, by talking about what's happening on the ground and not just theories, and also by not doing magic bullet stories. That's how we avoid advocacy. We don't overclaim or predict the future. We don't say this thing that's being implemented where there's limited evidence in one community right now that everyone should go ahead and replicate it, that it's definitely going to work. Keep the slice really small, talk about what you know, and also be transparent about what you don't know. This is a time where people really need, especially that transparency, just to be honest about this is what we know, this is the limitations, this is even the limitations of the evidence that we have right now, so that folks have a clear idea of what's working and what we know about it. We also want to touch on the full landscape. Maybe your story is a small slice of the response, but if you have the space, if you're not doing a very short radio or video story, you can talk a little bit more about what else is going on to respond, to this particular problem. And again, solution stories are about the idea behind the response, not just a person, not just an organization, not just one amazing thing. It's about the evidence and limitations in the bigger picture. I had a journalist ask once in a workshop, he said, I'm not allowed to tell people what I don't know. Who says that's allowed? And his boss was sitting behind him, and I said, well, is he allowed to do that? And he said, absolutely. And it really changed, his perspective on solutions journalism and on the things that were possible. So this is how we stick to not being advocacy, is really including those 4 pillars is the easiest way to stay away from that and to do solid solutions reporting. Are there stories in, the question is, are the stories in the tracker vetted to ensure they meet the 4 pillars? That is how we're vetting stories. We have a team that looks at and reviews every story that's submitted before it goes into the tracker. And this is exactly where the starting point for them.
And that said, if you read something in there and you say, I don't think this necessarily hits the 4 pillars, there is the possibility to click and say, I don't think this is solutions journalism. And then we'll go back and redo that, but it is done by people.
It's done by people. And so, it's not absolutely perfect, but we're certainly trying and we appreciate feedback. There's a really important question here about COVID-19 cases in an incarceration facility. Do you have any tips on getting more than just official voices? I've been seeing those as well, and I have been thinking about, exactly in the questions that we have about how to do stories, like who is vulnerable and whose needs are not being met. I would say one of the things that comes to mind for me is community advocacy groups, very grassroots groups that work with people who are incarcerated and their families. I think that's a starting point in getting some different voices, people who are experts and have been working on these issues for a long time, because although this is a crisis right now, the health and well-being of people who are incarcerated is an ongoing concern, and there have been efforts going on for a long time to address the health needs of folks who are incarcerated. Michelle, do you have other ideas for sourcing around that?
Yeah, I would definitely try to talk to family members as much as possible. Right now, it's going to be difficult. People have to answer the phone. But yeah, I would reach out to family members to get started.
Other questions? This is, we've got some more time here to answer a few more questions.
And while you're asking those questions, I'm going to be putting in here in the notes, and I'll also have that in the email, some non-solutions resources for just getting data, looking up things for community and government responses in your country, wherever you are. And then there's also a resource there if you are covering COVID and you've never done any kind of science reporting before. What are the big do's and don'ts? And I really loved this story for newbies.
Mm-hmm. The list of questions that we consider. Sure, I'll go back to that. These are questions that we use in our general workshops. Who's doing it better? How does the response work? What we call the how done it. What metrics matter? And this is a really interesting question, because what metrics matter to me says is there are lots of different ways to look at that. It's not always exactly the same for every story or every community. For example, part of in my career, I spent several years working for a Native American owned media outlet. And when we did stories, sometimes there was very limited evidence in doing, for example, a health story, where we said, okay, this is what the Western perspective, the Western medical perspective, how they measure successful outcomes. And we would hear from our sources, that we were talking to, that didn't fully capture how the tribe or how the community was looking at the response, that there's also traditional knowledge and there's other ways that the tribe was measuring success that didn't exactly fit in a Western medical model. And so we would include both. We would say, this is what we know about measuring health outcomes for people, and this is the evidence that we have that this is working, and this is how the tribe measures success, and this is how they're looking at what's working and what's not working. So I think there can be a lot of discussion around what metrics and what evidence is most effective for your story. I think always too, who is the response not working for will really keep you away from magic bullet stories. It's the quickest way, to not do a story that says this is going to fix everything, is to look at the limitations of who is it not working for. Are there language barriers? Are there cultural differences and barriers that you want to account for that would need to be addressed to make a response effective in different communities? What does the research say? What do the critics say? And is it already being replicated? There are examples in COVID-19 coverage of responses in one place that are already being tried and replicated in other places. And we can be looking at how successful are those? What have they run into that's different in a different community or a different cultural context?
Alfredo asked the question here, sometimes it's quite difficult to measure social impact, right? And yes, it can be difficult, but maybe having those brainstorming ideas, we can be available to help you out with those types of things. We have some mentorship programs to have those conversations of, okay, what would be some of the ways to do that, whether that be qualitative or quantitative, like what is the best way to do that? Who are going to be the right people to give you some really strong anecdotes, not just an anecdote, but something that's a little bit more measurable.
Mm-hmm.
And I'm trying to give you guys those resources. If they can't get, they're not going up in the chat for some reason, but we will put them in the email.
We have just a couple more minutes. Any other questions that we can answer right now to help you get started on solution stories? How do we measure the success of our stories? Still by likes or other impacts? That's such a good question. And it's something that every newsroom has to answer for themselves. There's a lot of different ways that you can measure impact. There's strategies we're using with newsrooms that we're already working with, of surveys, focus groups, looking at time on page, looking at clicks and likes and things like that. I think you have to kind of a tailored way that you're going to evaluate how people are responding to your stories. But certainly if you want to follow up, we're going to show our emails in just a minute. We could send you some examples of how other newsrooms are doing that, so for some inspiration for how to measure the success of your stories or the response to your stories. A strategic communications officer, this question is, how can solutions journalism be applied to corporate communications? You can, I think, including the limitations, including who's it working for and not working for. Those 4 pillars of solutions journalism can be applied to strategic communications too. What about freelancers, people who aren't in newsrooms? There was a comment just a moment ago, I think from Jody, saying, be ready to answer, to talk about the 4 pillars in your pitch. I think that's a great strategy because, again, solutions journalism at the heart of it is just good journalism, and being able to lay out for a potential editor the problem, the response, the evidence, the limitations. That's a great pitch right there. That answers a lot of questions that they would have anyway, makes it a strong solutions pitch as well. Oh, freelancers in measuring impact, I think you're gonna need to work with a newsroom, although you could track, when you share your own stories, you could track the response in your own social media if you wanna be able to have those metrics to share with potential editors or other people later. Newsrooms do it in different ways. What about small newspapers that cover neighborhoods? Are they likely to find solutions around the corner? You absolutely could, Sharon. So one of the things that I noticed when I started leading workshops on solutions journalism and thinking back to how I had utilized these skills in my own reporting was that sometimes seeing a story in the tracker from another community or asking these questions did help me identify, when I was a reporter and producer, stories that I just wasn't aware of, things that just I wasn't looking at, wasn't on my radar, wasn't in a press release. So it's a great opportunity for enterprise reporting in your community to go looking and asking questions about responses. Could be and also could be a small slice. I tell people sometimes the response in your community is about one school, one neighborhood. It's a limited look at a bigger problem, but you can look at the evidence for that, and you could do a great solution story in your own community. You don't always have to go somewhere else looking for what they've done. It could be something that's already happening around the corner. We can go a little bit longer. If folks want to stay a little bit longer, Michelle and I are available.
Yeah. If before we do go off, can we just talk about the other resources that we
Sure.
have at SJN? We'll stick around a little bit longer for some folks. There's a lot of questions coming in. If we don't answer your question now, we'll do our best to email you afterwards. You can also email us directly if you didn't have your question answered. Can you go to the next slide, please? Remember, we are here for you. We have at solutionsjournalism.org lots of information for you. We have this solutionsjournalism.org/hub. I really want to focus on this part of here. There's a lot of different information there. You can look at that at your own time, but this part where it says get trained, because in there are, for those of you who were working in broadcast and you want like more on like, how do I do this around television? There is a at your own speed module that will help you do that and has all kinds of tips. And, it tells you right there how much time. If you're an editor who's here, you're like, okay, this is great, I'll take these pitches, but you need some help on like, how do I edit this better? There's another module there. If you're on the health beat or haven't done the health beat, it's there to help you with that. And then later on, for those of you who are education reporters, that's there. And we're adding new modules all the time. I think this is a really great place to get started. And if you need to do this a little bit slowly, or you want to share this with somebody who's not done this before, there's also just this intro that is at your own pace, very similar to what we've done today.
And our colleague Linda Shaw has dropped in a survey into the chat. We'll also be sharing this in email. Please do fill out the survey, because at SJN, we're working on what resources can we provide to freelancers, to newsrooms, to journalists right now to help you do your work. So filling out that survey will really help us drive the resources that we're creating to serve you. It'd be really, really helpful if you could just take a couple minutes and fill that out for us. I wanted to go back to a question about, there is a question about, in our experience, media switching to solutions journalism are doing better in financing and economic terms. We are still working on that. I like to tell people, just as we don't want to see magic bullet stories labeled as solutions journalism is not a magic bullet for journalism's business model, but definitely we are looking at the evidence and doing research and working with newsrooms to measure how can they effectively use solutions coverage, communicate to their audience the significance of that, and tie that into their business and revenue generation. We don't have all the answers yet, but we're continuing to work on it. And so keep coming back to our website as we have more information that we can share publicly with people.
And we do have some beginning sense that people, when they click on the stories, they're more likely to share it on social media, that when they do click it on social media, they're more likely to spend more time of it. Those types of things are really important, and they're important for helping your business model as well.
Yeah. A question from Odette. Do you have a recommended list of tactics and sources for vetting rapidly evolving health and science updates? Michelle, as a former health reporter, do you have some resources or ideas there?
Yeah, I'm really trying to send those into the chat, but I can't paste it for some reason. So it'll be in the email. Those are just some beginning ideas. If you've got a specific thing that you would like to talk to me about, I'd be happy to talk to you about it a little bit further.
All right.
And tomorrow we're doing the same thing. It's a little bit more advanced, and we'll be able to do a little bit more of that.
Wonderful. What are suggestions around, with COVID, a lot of evidence is contested, keeping children in school or not. There are arguments on both ways. What are your suggestions around covering that, or might it be too soon? It's a pretty challenging topic, because really what we need to look at is countries that have already done this for several weeks, and what have they learned from this, extreme social distancing and really restricting people's movement. You would have to look at the evidence there of what we already know about that. And I think to really focus on the evidence and to look back and see, are there any other relevant examples from previous pandemics that we could learn from, to kind of get out of the politics and the arguments for and against it right now. But Michelle, do you have other ideas around that too?
Yeah, I think what you're saying is on point. I also say that this is very similar to some of the work we're doing around complicating the narrative. When you've got very hot, controversial issues, we've got some blogs around that when you're dealing with those things at the whole story in our Medium account. So you could read that. And we're also working to improve that and put more lessons there. It's kind of new work, so we don't have everything available online right now, but get started by checking out what we've got at our Medium account. And we've got a COVID vertical there that has new blogs coming up every day to help reporters.
One more question. Any tips for adapting the whole framework to social media reporting? Michelle, do you have some insights there?
I mean, that's a little bit challenging because I've done some social media reporting, but with a lot of help with the really strong reporters who are more familiar with that. So I think it just depends. If you're doing a social, like if you were doing a story on, say, Instagram, and it's a video story, you're going to use a lot of the same tactics that you would use in any other video stories, except a lot shorter and quicker. Just making sure that you're keeping those four pillars in however you do it. If you're doing a story thread, just make sure that that thread has different points. I think the evidence is really with any story where people really are going to be like, oh, well, when we know that that's working well. Again, with breaking news things, we don't have as much evidence, but we want to try to find the pieces of evidence that we do have. What's the promising bits? But then also always reminding folks, this is what we know as of now. Here are the major caveats with this evidence if you've got them.
Also, a question from Sophia that I think is interesting. I work with a few local newsrooms and want to introduce a solutions approach. It seems very new to them, who are always busy and many understaffed. Would you recommend choosing one reporter to focus on solution stories as a starter approach, as opposed to trying to implement with everyone? It's a really interesting question, and I have seen examples of both. Sometimes there's a reporter that's really passionate, has done training with us, is ready to get started on doing lots of solutions reporting. But I would say it is useful for the entire newsroom to go through at least our basic webinar and to all be on the same page of what we're talking about solutions journalism, so folks can be talking about it in the editorial meetings. We like to say not every story is a solutions story, but solutions coverage can always be on the table when you're deciding what are those important stories for your community. So I would recommend trying to get the entire newsroom to at least do the training. But if you're talking about right now, if you want to encourage some solutions reporting right now on the current crisis, if there's some people who are interested, it might be good to invest in just them right now and then bring on the rest of the newsroom later. That could be one effective strategy. All right, I think we're going to wrap it up here. We will look and see if there are any other questions that are unanswered.
There was one more question that I'd like us to talk about, and I'm going to toss it to you, Sarah, first.
Sure.
And that comes in the Q&A portion that you may have missed. And it says, what advice to new real-time beginner reporters, practical plan to begin searching and writing?
To begin searching and writing, I think go to those questions of, that we had on our blog post of, questions to ask about COVID coverage right now. Answer one of those questions and then walk through the 4 pillars. Define what is the problem, and the problem is more specific than just the COVID-19 outbreak, but what is the problem in the community? Is the problem that people aren't being tested? Is the problem how might parents homeschool their kids if they have to, if they're not in school right now? Define the problem really specifically, answering one of those questions, define the response, and then go through what's the evidence, what's the limitations, what are the insights. I think I would follow that step by step, and you will have, and you don't have to make it a super long story. Keep it to a short story of what you can verify, and that's a great way to get started on a story as a brand new reporter. All right. These are the questions I love to leave people with. Who's doing it better? You can ask this at any point in your reporting process. And you can ask your sources. If you have existing sources, you can ask them who's doing it better, because people working on these problems, whether it's COVID-19 or it's another problem, they're often looking at their colleagues in other cities, in other states, even in other countries, and thinking about those ways that they're responding and what they can learn from them. People are already asking those questions. And as reporters, we can then bring that to our audience, and we can do that vetting and that reporting on how well it's working to really inform people. And we can ask ourselves, is there a possible solutions angle to this story? It's not always a solution story, but it's a great question to ask to give yourself opportunities on new angles, especially, we're right in the middle of this crisis in many countries around the world right now, but this is going to be months, maybe years. There's going to be new angles that we need to be developing all the time. And so this is a great question to keep asking yourself, to identify what stories have you not told already that are really important to cover for your audience. And then this is our contact information. You can email us directly if you have more specific questions. We can connect you with SJN Resources. Also, again, our website is solutionsjournalism.org. We have, resource guides, playbooks that look at, collaboration, covering health, covering education, covering violence. We're developing more resources specific to COVID-19, so please do fill out our survey, and we will get you as many resources as we can. We'll be doing more webinars. We'll be posting more blog posts, really trying to meet the needs of journalists and student journalists. I really appreciate the folks who are looking out for how to bring this approach into the classroom. It's a really important opportunity. Thank you again for your time today. We so appreciate this, and we are here. We want to help you. Let us know how we can do that. Michelle, do you have a final comment?
Yeah, and again, if you're on here and you're international, we have folks who speak many, many different languages. Yo, por mí, hablo español y les puedo ayudar en español. And we have a wealth of information in many languages from people who've worked in photography, just everything. So if you have a specific question, come to us. We'll find the answer for you.
All right. Take care. Stay healthy. Thank you so much.